Catalyst 2030 started life as a WhatsApp group among social entrepreneurs, connecting to envision real transformational change. Launched at the World Economic Forum in January 2020, it's grown into a global movement accelerating change to ensure the SDGs are reached by 2030. Fueled by passion, our 550 members working in 175 countries have collectively put in an amazing 50,000 volunteer hours, touching the lives of 2 billion people. And we're driven by values, to which we hold ourselves accountable. 2020 was a busy year, co-creating 3 reports with partners and producing one of our own. Inviting high-level guests to participate in the Catalyzing Change campaign, hosting fireside chats and expert hours, which will be continuing in 2021. To celebrate our achievements, together we placed our supporters in the limelight with the first Catalyst 2030 Awards for Systemic Change. With the blessing of the Dalai Lama, we celebrated finalists and winners in the following categories: special recognition for our early supporters, individual philanthropists, donor organizations, philanthropic intermediaries, corporate organizations, bi- and multilateral organizations, and 4 regional winners in the category of national governments. And now on to Catalyzing Change Week 2021. During this social entrepreneur-led event, we bring together diverse stakeholders in over 100 sessions to showcase their systems change efforts and the best practices that can accelerate our work in pursuit of the SDGs.
Well, good morning, good afternoon, good evening, wherever this might find you. My name is Fred DeSam Lazaro. I'm a journalist, a television journalist based in the United States, but in non-COVID times, I'm usually in the field in Sub-Saharan Africa, South Asia, Southeast Asia, reporting on a number of pressing global challenges and partnering with a number of social entrepreneurs to tell their stories or bring the issues of undertold stories to an American audience. And my role here today is simply to be the traffic cop in a discussion among people who are far more knowledgeable about the business of bringing vaccine equity as we face the ramp up, we hope, soon of vaccines across the world. I was struck by an op-ed that I just want to get us started thinking about. As a news person, we're just consumed these days with news out of India, and there was an op-ed in the Washington Post by Madhu Pai and Manu Prakash, who are both scientists. And here's what it says. It says, India is a cautionary tale for the world. It's proof that we cannot fight this pandemic country by country. By the time we put out one fire, we will have to fight another. World leaders must think beyond their borders and do the right thing for all of humanity. There's a lot of trench level field experience represented in this panel. And I'd love to get to the actual strategies, innovative strategies that you bring to this discussion. But because the stories and the news are so present right now, I thought we'd give ourselves a little context to begin with and get snapshots and a news update from 2 of our panelists. And I want to start with Purnima Ranawat from India. And you're right in the middle of it in so many ways. And I wonder, Purnima, if you can start it out by just telling us, you know, what you're looking at outside your windows these days.
Thanks. Thanks, Fred, for having me here. I think by now most of you have seen both the numbers and the devastating pictures coming out of India, and I'm not going to whitewash it. It is just as bad, or actually probably worse than what you see. We crossed 400,000 cases per day recently. And in the first wave, we hadn't even crossed 100,000 at our peak. And so that's a 4-fold increase. The health systems in the largest cities like Delhi, Mumbai, Bangalore, which are the best equipped cities really in the country to handle critical care, are buckling completely under pressure. The last year, people were scrambling for ventilators and ICU beds, and this year we see that people are scrambling even for basic oxygen, and it's really heartbreaking for us. So many of us, me and my colleagues, we've lost friends and relatives, and we've lost count really of how many people we know that have gotten COVID in the past weeks. But a lot of people are also recovering, and at the same time, we see that there's incredible efforts by communities, by individuals, and by organizations to come to each other's side. My social media, my WhatsApp groups are full of people trying to help complete strangers get access to hospital beds, to ICUs, organizing plasma donations. I saw a rickshaw driver or a tuk-tuk driver put an oxygen tank in his vehicle and is helping people who need oxygen, transporting them to hospitals for free. We're a very community-driven culture, and during these very hard times, we've seen the community spirit and resilience come through and find solutions to save lives, and hopefully we'll come out on the other side.
And we look forward to discussing what wrinkles that might add, what's happening in India right now as you try and get vaccines into arms, as we continue with this conversation and your work with Swasti. I want to go on another news front to Fatma Hussain, who's a legal scholar and activist in South Africa. Fatma, there's news in the last 24 hours or so that adds perhaps a positive wrinkle to what we're dealing with globally. Fatma?
Thanks. So, I think the positive element that you're referring to is basically the announcement by the Biden administration last night or Thursday evening, which indicated that they would no longer block the opposition to the waiver proposal that's been presented by India and South Africa from October 2020 already, and that they wouldn't block the proposal for a waiver of intellectual property provisions related to COVID-19 vaccines. Remember, the original proposal was for COVID-19 technologies, so diagnostic, testing kits, ventilators, oxygen, treatment, all of the things that Purnima has identified as being in desperate need for to manage the epidemic in India. And now we're seeing in Nepal and we're seeing in Sri Lanka. So basically, it's a small step forward. It's quite historic. I've been doing this work for many years, and to have the US government actually come out in support for the suspension of intellectual property protections, even if it's on a limited basis for a limited time for a specific product, is quite significant. It could potentially pave the way for greater manufacturing and scale up, depending on how long it takes to actually negotiate the text of the waiver and what happens next in the next few weeks or in the next few months. I think what's important is that we needed that political breakthrough. We needed sort of the countries that were blocking the waiver were really taking their lead from the Biden administration. Now that they've done that, the EU has given some preliminary indications today that they may also be willing to discuss the waiver now and not continue blocking the waiver. But we can go into the details of what the waiver means and what this proposal actually entails. But yeah, that it's been a really hard 8 months. We've had 3 million people dying in the time from the waiver being lodged to yesterday, 2.2 million people had died. We're seeing the situation unfold in India, many parts of the world, in Brazil. It's really disheartening. So the fact that it took so long also for the US government to actually come out and indicate a willingness to even discuss the waiver is something that is also cause for concern.
So it's a green light on a very long road that still is ahead. Okay, we'll come back to you again, obviously, to mix that in. So we have sort of a preamble. This is what we're dealing with, a snapshot of today. And I want to next go to Dr. Dajani. And in looking at your CV, I don't know a soul that has as eclectic a set of experience and expertise in so many areas. But you have been front line in reaching populations that are often underserved in many ways. And I wonder if you can globalize and extrapolate from your experience in Jordan. You're joining us today from the University of Richmond, where you're a visiting scholar, but from all of your experience, particularly with refugees, what can you extrapolate about the landscape that we're looking at, that innovation will be needed in order to get vaccines out there?
Yeah, thank you very much. That's a very important question, and I think I'm going to start with, sometimes innovation doesn't have to be fancy and high tech. Sometimes it's very, very basic. So from our experience, one of the most important things is awareness, raising awareness, because most of the challenges is people not accepting taking the vaccine because of misinformation and ignorance. So that's a component which we must keep in mind. And so how do we go about doing that? Whether it's through word of mouth, having advocates on the ground who are role models themselves, taking the vaccine themselves, talking about it, having these discussions and let's say debates, but also innovatively trying to find who are those key points, who are those people who have the influencers within the communities that we're talking about. And many times we see that religious leaders play a very important role, especially in the developing countries where the vaccine is being rolled out, but it has its own challenges in people accepting them. And we tend to not include these people, although, and I speak of the MENA region and large areas of the Muslim world, where if we go in through them, we can help provide the evidence and the advocacy and the logic to help convince people to take the vaccine. And just building, I'm giving you some quick lessons, building on the history of the Islamic civilization. There was an article in the New Yorker on how people were using something similar to vaccination 300, 400 years ago, using smallpox, taking little pieces from people, and the old women were the ones who did it. So just speaking to the history lets people's guards go down and to accept what's happening and accept science. The other thing that I would also want to share from the being in the Middle East and from Jordan, where we have one of the highest percentages of refugees in all the Levant area, and in Jordan in particular, we are 9 million, and we have almost over 1 million Syrian refugees and other refugees from other countries. One of the important points is leadership. So the Jordanian government has mandated that anybody on the soil of Jordan is eligible for a vaccine, regardless. So we are one of the first countries that has been rolling out vaccines for refugees. I was just on the phone with one of our volunteers who is a Syrian refugee in the Za'atari camp in Jordan, and she says, everybody, you go on online, you register, and there are centers if you don't want to do it online. You register your name, and it goes. You're in a line for an order. They start with the older people, the more vulnerable, but everybody's eligible. As young as even they're going down to a young as age 18. So it's out there, and this is great, and this is amazing. When people from their mouth say they feel safe because they feel that even if they're a refugee, they have the right for health. And I think this is very important, this equality and equity and fairness in rolling out the vaccine, because as was mentioned earlier, we are only as safe as every human being. If one person is not vaccinated, then we're all not safe. So these are some of the highlights that I wanted to share from our experience working at the grassroots, listening to the people themselves.
Mm-hmm. Mm-hmm. Purnima, I want to come back to you now on this whole task ahead of you to reach hard to reach populations, and essentially build on something that we just heard Rana talk about, which is to build trust at the very grassroots level, which is at the heart of what you do with Swasti in India at multiple levels. Can you talk a little bit about how you forge your partnerships to do that?
Sure. Thanks, Fred. So just for a little bit of background, last year, the Catalyst Group in India anchored efforts to bring together organizations that wanted to serve the most vulnerable communities. and help them weather the impacts of the pandemic. And really what this has meant is that more than 300 organizations have come together with varied levels of expertise in livelihood, in public health, and private sector. And this ecosystem has both organizations that come up with solutions and those with incredible reach, such as civil society and community-based organizations that can take these solutions to communities that are otherwise hard to reach. And this includes migrant populations, farmers, sex workers, fisher folks, informal sector workers, construction workers, just to name a few. And so when India announced the vaccination, like Dr. Dajani said, we tried to look at what were the issues that these communities are likely going to face. And like everywhere, the first is low demand due to hesitancy. And we realized that people have genuine questions about vaccines and if they're right for them, if they're safe, if they have HIV, will they interact with their drugs? If they have thyroid or autoimmune, should they take the vaccine? But no one really they can trust to answer these questions. And in blanket messaging that we were seeing going out, that vaccines are safe does not always garner trust because of the deep mistrust that's already there due to fake news, etc. And this is not specific to India, right? We're seeing this everywhere. And the second issue really is around how do vulnerable communities access vaccines in rural areas? Travel is an issue. Currently, you need to register on a website to get a slot, and you need to have a phone and an ID, and it's hard even for people who are tech savvy. These don't take into account the digital and literacy divide. So in terms of the solution, like we talked before, it's not a magic bullet. It doesn't have to be a new instrument. What we are working on through the collaborative is really using the trust capital built up over the years by the community-based organizations, more than 150 now that work with the collaborative, and just empowering these organizations to communicate effectively and answer questions that come up within their communities, giving them the right tools to answer these messages, and also nuance these messages based on what feedback we're getting from the community. For example, I don't know if many people here have taken a shot, but I felt awful for 2 whole days after taking the vaccine. And if I didn't know that this was normal, it would have been really worrying. And this is exactly what we heard when we spoke to farmers in Karnataka, for example. Many of them said they didn't want to take the vaccine because someone they knew had a high fever or felt really sick after it. And a lot of people didn't know that they had to come back for a second dose. So it's important to ensure that the right messages get to communities and that we're able to answer the very valid questions and concerns in order to help them make a decision. And around the access issues, almost all CBOs we work with have some kind of on-ground staff with local knowledge, and empowering them just to understand the vaccination process helps them turn into leaders in their own communities. They can get organized and they're getting people registered, have volunteers with phone and internet connection support that the ones that don't, work with local health centers to run vaccination drives closer to the communities, essentially making the pathway to accessing vaccines easier for the communities they serve. And so a solution is not very innovative. It's really just going back to the basics, using the power of the collaborative to empower communities to scale so that they can take matters really in their own hands, so to speak.
Right. Okay. And finally, I want to go to Mahali joining us from, I'm not exactly sure where, because the geography in your CV is so diverse. You began with riders in Lesotho and have spent a lot of time in West Africa, and I believe Ghana in particular. And as the name implies, you have a lot of last mile issues to deal with in logistics. So Mahadi, please share.
Hi, thank you. Yes, I'm actually in Lesotho, and yeah, although I'm representing riders from across the continent, but now I'm sharing with you from Lesotho, but on behalf of the rest of riders. So yes, we we are faced with the problem of making sure that all the healthcare reaches even the most difficult people in their communities. So like the terrain we have in Lesotho and other countries where we work is very difficult, to the extent that sometimes you'll even have to diversify the mode of transport you use to get to these people. And so most of the time we use motorbikes, sometimes you use 4x4 ambulances, sometimes you use normal ambulances. And then, but depending on the terrain and on the geography or the country we are talking about, and also the health infrastructure being where these structures are based and where the communities are able to access these services. So it's always a challenge because usually, like now when we have vaccines, we have vaccines in the country now, but because the country wasn't very prepared to, we were just excited to get the vaccines to the communities, but not clear plan on how this will be rolled out to the rest, even the hard to reach areas. So we saw a place where a lot of vehicles were, temporary vehicles were being hired. And so the government incurring a lot of expenses which could have been avoided if proper planning was done, and the health system had a system in place already to kick into place immediately when you have a situation like now we have COVID-19. So it's like we always rush into things trying to address the problem as they come, but if the system is already prepared, we'll be in a position to respond timely in times like this. So we as Riders for Health, we always face a problem of coming last in the plan when people are planning for interventions, because people want to see vaccines, they want to see things that you can point and show the world that you have donated so many or you have supported the country with so many vaccines. But the point of the question of how these are actually going to reach the people is actually the same as when outreaches are established, is to make sure that even the people who are in the most remote areas, sometimes not even accessible by road, but you can have an outreach service closer to where they are so they could walk. It's the same mechanism when you have to distribute the vaccines. What is going to happen to those people who are not easily accessible, even with normal day-to-day healthcare services? And then by the time that question is brought to the table, all the money is gone to procuring these vaccines, to making sure that, and when you talk about how these things will end up getting to the people, then it becomes a challenge, and people complain about how expensive it is, how time consuming. But we have seen in other countries where even vaccines have expired before they reach the people because there was no system in place on how they will actually get to these people. But it's not only getting the vaccines or the medication to the people now. When they get to the people, there's a lot of waste that is generated in terms of old used syringes, and then, vaccine bottles, and a lot of waste that is generated while delivering this service. Nobody has, how do you make sure that these are properly being disposed of without endangering neighboring communities? So this is also what Riders is concerned about. When you do like transport logistics for health, you look at the whole picture, not only, solving the problem now. If we are prepared and we have a response plan in place, when the outbreak hits, or when the problem like this hits, we know how we can equitably distribute the services so that even the less fortunate people or the most vulnerable population gets the services, on time, and they are also prioritized. So this is the challenge we try to solve in all the countries where we work, but unfortunately, transport always comes last.
Yeah. Well, I wanted to, before we mix it up, invite you in the audience. If you have a question, to by all means write it in. I believe we can do that in the chat function of this Zoom meeting. So please do chime in if you can with a question or comment. Listening to so many of you, it just occurs to me that so much of this exercise involves building trust for accepting this vaccine. And I'm just wondering whether, in the face of vaccine shortages and what's happening in India, for example, whether the fact that the vaccines just aren't available or won't be for so long is going to fight that trust narrative or the mission. I mean, are you going to lose trust if you prepare a population to accept a vaccine that never comes? Who wants to take that? Rana?
Yeah, that's a great question. And it all goes back to the concept of trust. So in Jordan, for example, we did a quick research last year. I mean, not me, but a group of scientists asking people's opinions of who do they think should take the vaccine first. And I think this brought to the surface that we need to, when we consult with the people of a particular country for their opinion of who do they think should go first, that's how you build trust, because you include them in the conversation, you include them in the decision making and then the process. And so they think through it rather than playing the role of the victim. Why are they not giving it to me? Or why are they giving it to me? You put them in a position where, who do you think should take it? And that makes them think seriously. And that's about trust, and it's about respect and giving agency to the people in the country, that these people understand, they know what's right and wrong. They don't have to be educated, by the way, but they have that value, that moral ethic of what is right and what is wrong. And when we did that, actually, we discovered a new category that the Western surveys did not include when they were looking at who is the category of people you think should be prioritized. And that is, and this is culture dependent, is, for example, the person who is the breadwinner of the family, who takes care of the family. Because if that person dies, then the whole family is in chaos. That was never on any list of any survey who was looking at ethics, to my knowledge. But so that's one issue. The other issue, I think, also to innovatively build that trust involving is language barriers. Back to the point of my colleague, is that many scientists, many people don't have access to the proper information in their own language. And so I think here, one way we've been working at the Society for Advancement of Science and Technology in the Arab world, this is a network of scientists in diaspora from the Arab world to speak in Arabic through social media or through, in connections, to explain in Arabic, what is the science behind this, why this vaccine, what are the complications, what they mean. So this has been fantastic. And the other thing is creating children's books around this, which we have done in Arabic and distributed as part of our program, We Love Reading. But the issue is, people may say, oh, but this is, we need to do it now. But we need to remember, as Mahila said, this is long-term. This is not going to go away tomorrow. And we need to start planning from now, having that long-term vision. Yes, it's a crisis, but we know there may be a booster vaccine. So you're going to run into the same problems next year. There may be another pandemic for all we know. So let's keep a balance of, yes, crisis mode, but also planning ahead in parallel to ensure that we at least, face a new problem rather than just being stuck in the same problem come next year.
Fatima Hussein, I was going to ask you, given the history in South Africa with HIV and so many similar issues, it wasn't a vaccine issue. We still don't have an AIDS vaccine. But there were so many issues of inequity that had to play out in South Africa at the cost of so many lives. And I'm just wondering, as you see things evolve here today, and building on this whole issue of trust in the rollout and resource allocations, weigh in a little bit, if you would, on what you're seeing in either direction, whether hopeful or despair.
Thanks. So what we saw in HIV/AIDS was that the global South and Black people and brown people were not prioritized in terms of access. So either, for example, antiretrovirals were priced so excessively because of patent monopolies, and they were just not basically scaled up for production in the global South. So many of my clients, for example, and my friends basically died, right, prematurely, because they couldn't access affordable ARVs. And that's a similar situation to what's playing out in India, Nepal, Sri Lanka, many parts of Africa as well, until we are able to get vaccinated, until there's widespread vaccination, because many people who live in, for example, my country can't socially distance. they don't have access to clean sanitation. They live in informal settlements. I mean, Rana's talked about refugee camps and, people who are internally displaced. So the non-pharmaceutical interventions is great for people who live in middle income and high income countries where there's secure and safe housing, where they have secure employment and proper socioeconomic relief. So the similarities with the HIV/AIDS crisis and COVID crisis, which is what we warned about last year already from 2020, we've been warning since March 2020. We said, don't go down the same road, because what's going to happen is that the global north will get access to life-saving interventions before the global south. And guess what? In May 2021, that's exactly what has happened. 1 in 4 people in the global north have already been vaccinated because they either overbought supplies or they took up most of the supplies from COVAX, which is supposed to be the mechanism to supply low-income countries, and they entered into advanced market commitments, and it's what we call hoarding. So in some cases, Canada, for example, Australia bought more than what their population actually needed. And so, there's excess doses that they potentially have that they could actually be sending to the global south. So the situation is that 1 in 4 people in the global north get vaccinated. The situation in the global south is 1 in 500. 0.2% of the vaccine supplies that have actually been administered have gone to people in the global south. And that means that our lives have just not been prioritized. It means that intellectual property basically took precedence over, the claims and the rights of like a handful of CEOs. And I mean, the other question, and I think Rana pointed to that, is that within a space of a year, you've got vaccines that are considered safe and effective, but they are different because they are effective in different ways, and they're also administered in different ways. Some are 1 dose, some are 2 dose, and that is contributing to vaccine hesitancy and vaccine information. What we had to do with HIV/AIDS was do a lot of treatment literacy, and I think Purnima talked about that, where you've got to do the old-fashioned ways of organizing, right? Train the trainers, but you can't do that in a pandemic where you have to socially distance. So how do you train the trainers on Zoom? How do you train community healthcare workers on Zoom? And so people are finding more innovative ways of trying to do that. But the global disparities in terms of access to vaccines is so severe, because in the absence of everybody continuing to do non-pharmaceutical interventions for the next 3 to 4 years, I mean, it's unsustainable. People have fatigue. Right? People are just not observing all of the different restrictions they may have in March and April and May of 2020, but people are exhausted. And so, if I put this in perspective about the 1 in 500 and the 1 in 4, I'm really not embellishing. In my own country, my mother, who's 75, hasn't received the vaccine as yet. Yet there are 5 safe and effective vaccines that exist in the world. There are young people in New York who are my friends who are getting vaccinated. All of the healthcare workers in South Africa haven't even been vaccinated, because we're getting a drip feed of supplies from a handful of companies who we are totally dependent on for supplies. That's Pfizer and Johnson & Johnson, because we've paused the AstraZeneca rollout. And when you pause a rollout, when you say there are blood clots, when you say we're starting Johnson & Johnson, no, we're stopping it, and then we're starting, that also contributes, I think, to the vaccine hesitancy that Rana and Purnima is talking about. So yeah, I mean, the situation is very disheartening, and that's why there's a sense of urgency from activists, and that's why we were hoping that the waiver would be resolved much sooner, but anyway, be that as it may, this is the point at which we're at now.
Yeah, I think I'd like to move us along to discussions of the options that are available, and where is there innovation possible to move forward. What you've talked about, I think, is very, very predictable. You predicted it. We knew this was going to happen, is what you're saying, or we predicted it would happen. Pin some hope that it would be different this time. It isn't different this time. So the question to everyone here is, how do we reconcile with the geopolitical reality that is played out as it did before, so many ways similar to HIV? What's to be done now, reconciling with those realities, and even as you try to move the needle there and try and get more attention, what's going to change what we're looking at today? Who wants to take that? Go ahead. Mahadi, did you have your hand up?
Did. Yes, I think making sure that moving forward we can just make sure that during the planning phase, we also have an emergency in the country, not wait for us to get an emergency. We know the problems that the health system has, together with the supporting partners have in the countries. And like for disease control, they have a preparedness and response plan. Why can't we have preparedness and response plan? A comprehensive one, including transport issues and also
Oh, Mahadi, I'm really
about
sorry, but we're
how are
having,
these things going to get to the people who are.
I'm sorry, you're coming in bits and pieces, and I think some of us are able to sew those together into a whole. And I think what you're saying is you need to be at the table.
Oh, I'm very sorry.
Infrastructure problems in this conversation themselves. We have Andrea Coleman from Riders as well. Andrea, are you able to chime in at all on this question of, and I don't mean to put you on the spot, but would you be able to weigh in until this internet connection improves?
Yeah, thank you, Fred, very much indeed. I believe that what Mahadi is saying, that obviously local government preparedness in all of those countries needs to be done in terms of preparedness for emergencies of all kinds. And certainly we know from WHO that this isn't the last pandemic that we'll all be facing. So I think what we believe at Riders for Health is that the governments in Africa and India and other places that as has already been said, in the global south, really makes a much bigger pull on the issue of being of inequity. And now is the time to show that, as Rana has said, unless everyone's vaccinated, no one is. So it's so important to iron out for everybody's best interests the inequities that exist. So I believe I'm representing what Mahadi was going to say as best I can. Thank you, Fred, for asking.
Thanks for pinch hitting, as we say here in baseball, which I know very little about anyway. But anybody else want to weigh in on this question? Purnima, please.
I mean, I think we talked about this already a little bit in terms of vaccine availability. Manufacturing capacity is going to become a big issue. And we know that countries in Asia and Africa that already do have manufacturing capacity, we can, and it takes a lot of time to build this. As we wait for the waivers to come through, as we wait for the politics to sort out, I think we should also be thinking about how putting the mechanisms in place to bolster this capacity, not just in India, but also in all of Asia and Africa, in countries where this is possible. And I think the Lancet Commission has been talking about this in India quite a bit, urging to governments to invest in the private sector that's able to manufacture these vaccines. Also, like Mahadi said, having these systems in place takes time, and I think Dr. Dajani also talked about the same thing. Sorting out the kinks takes time. Figuring out hesitancy takes time. Figuring out how to get the shot in the hands of the most vulnerable takes time. So if we can take this time where vaccines are not available to really get those systems in place and get our ducks in a row, at least we'll be able to scale up to, in India, we're saying only 3 million doses a day, but we should really be able to do much more than that at this point where we have such a huge pandemic.
Right. I want to move us along on this whole notion of what's to be done, what can be done now, and there's a question that has come in from the audience. What role do the panelists see for social enterprises more broadly in both the global north and south? in vaccine equity? And is there something that social entrepreneurs not working directly on health could do to help?
I'll take that one.
Please.
Or attempt to. So because we don't work directly in health. So for example, at We Love Reading, we have a network of individuals at the street level who read aloud to children. And so what we do is what we ask every social entrepreneur or every person to harness their own network of people they work with, even if they're not in the business of health, whether it's global climate, it's education, anything. You already have a network of people you're serving at the street level. So how can you harness the potential of those people at the street level to go beyond and see themselves as enablers, as influencers, every human, every one of those, for them to go out and do and maybe create something where they create awareness, they help people, this feeling of helping others. So what I see is a ripple effect. You're a social entrepreneur, you have a network of people, change those people into social entrepreneurs themselves in the sense that they go and help the people around them in the way they see fit. And they will do a great job because they know their community more than I would or you would at that level. And so they would know where are the gaps, what are the entry points, and what are those solutions, whether it's to get people to accept to take the vaccine, or it's about transportation, or it's about, gathering people in a place or organizing, whatever. But we leave it to them to identify their problem. But it's that mindset of a ripple effect. So that's what I would do.
Anybody else want to weigh in on that question? What social entrepreneurs can do? Fatima Hassan?
So, I mean, it's not really my field, but I think what we've identified in this particular pandemic is how do you get community groups and organizations and people on the ground to be ready for a pandemic? So how do you basically build pandemic preparedness systems within your countries where health systems are taking strain? And we're going to have more pandemics. It's not the last pandemic, right? So we have to prepare for the next one and the next one and the next one. So how do you create the shock absorbers and the resilience and share quality information and accurate information? The second, which is I think a bit more around technology and around investment, is how do you get the global south ready to be able to manufacture treatments and vaccines on its own for the next pandemic? Maybe even for this pandemic, maybe we'll have enough time. But the manufacturing capacity and the manufacturing readiness can't only happen, when you're in the middle of a pandemic. There needs to be that level of manufacturing preparedness where you do scenario planning and you figure out if you have so many billion people living in your continent and in the next pandemic, you need to urgently get out X number of doses of vaccines or treatments or diagnostic kits or ventilators or oxygen, how are you going to do that? And who are going to be the social entrepreneurs that are able to build that network? Because you can't rely on governments alone and you can't rely on the private health sector. If you do that, you'll just be waiting very long for access to any kind of decent healthcare.
I was interested in hearing from others about what Mahali had said, and hopefully we can hear you again, Mahali, but this whole question of resources and the way they are allocated. And as she pointed out, the people at the very end of the line, literally, were not at the table when decisions were made about where these resources and the funds were going to be allocated, and therein lies so much inequity. What's to be done about that? And maybe Mahadi, you have an idea yourself. I hope we can hear you.
Yes, I think we can continue to push through the agenda of last mile delivery and equitable access to health services by supporting the governments, because we know that it's not easy like you said, the government can't do everything. And sometimes they concentrate on the things that they were trained to do. But for removing the burden so that we make sure that everybody in the country gets access to these services. So if we become part of the decision-making bodies, like being part of the technical working groups, make sure that when the decisions are made, the planning sessions, we are all there. We make sure that whatever they do, whenever they plan, we are there and we push the agenda, because it's for the people who are in that country, so that we make sure that whatever is been decided, nobody is left out. If travel 800 kilometers just to reach 20 people, can we do it? Or can we travel 200 kilometers and meet 10,000 people? So that's, people always choose the best way out, the cheaper way out. But if the mandate of the government is to save health for all, irrespective of where you are, these are the difficult things which we have to make sure that we push into the agenda and make sure that they are never left out. Because if we as social entrepreneurs, we don't bring it up, the government will not do it. They will always do what is easier, but we are there to support government. Just make sure that we occupy all space wherever these things are being discussed. We make sure that our presence is felt, and we make sure that people recognize the importance of even these things which are considered smaller, to make sure that everybody can access the services, whether they have money or not, but because they are citizens of that country and it's their right to access these services, we make sure that we push that so that it is heard and it is included as the part of the response, preparedness and response plan.
So using your political leverage and savvy as much as possible. I want to ask you, Purnima, bouncing off the original point I was also trying to bring to the forum, which is the question of how you allocate resources. And there's a question from the audience on India specifically, is supply chain. And you know, I was reminded also of something else that Mahali said, which is the specter of waste and wastage of resources that don't get used because of infrastructure shortcomings. The question from the audience is supply chain and transport an issue in rural India for getting the vaccine to communities as well as in Africa? Does the health system already include transport for rural communities? So Purnima, do you see examples? First of all, answer the question if you can. Is there adequate cold transport to get this to every corner of the landscape in India, which is so varied? And are you seeing innovations, perhaps by social entrepreneurs, to get to that last mile?
Thanks. I'll talk about two things, I think.
Sorry to pack so much in there.
No. So the short answer is yes. India has one of the biggest childhood vaccination infrastructures in place, and we do get vaccines out to the last mile to a lot of kids on a yearly basis. So I don't think that a cold chain infrastructure, it's not great, but it exists and it can be done. We are seeing rural PHCs stocking vaccines. And remember, India is not currently using Pfizer or Moderna. So we are using the usual cold chain vaccines that are at 4 to 8 degrees centigrade. If we were to use Pfizer or Moderna, yes, I don't think we could get it to the last mile. But in terms of transport, that becomes a big issue, specifically if only one health center has in your rural area and then you have to travel 20 kilometers. We are seeing a lot of village level governance bodies step in here. They have the resources, and they do have some local level funding, and we've seen if the communities ask for it, they provide funding to go to the vaccine centers to get vaccinated. And each of the village level health workers has a quota now to get X number of people from their village vaccinated every day. So they are working out innovative solutions, but we do need to empower those communities to ask for the solutions, to ask their local leaders for that money that is sitting there for them. And I'll also take the previous question on resource allocation, just if you'd let me, Fred. We're seeing in the second wave a lot of donors coming in to fund different pieces, right? And just like Mahadi talked about, a lot of people want to fund commodities that are easy to count and things that are easy to count, and not fund the soft things that really get things into arms, that really get things done. So I think people have to get comfortable with funding those pieces of work. They're not an added expense. They're not nice to have. They are required for the commodities they fund to actually get to the places. And there also has to be a comfort level with working in emergencies. You have to have surge capacity. You have to adapt your grants to serve the people and not the other way around. So I think that's something we're seeing. If we see that shift in mindset, that would be really, really useful for organizations working on the ground to actually respond to what's in front of them.
Fatma, did you have your hand up? You did not? Okay. Rana?
Yeah, I want to pose a question to the audience because in terms of innovations. And I think one way is, we know the private sector has the money, right? We know where all the money is. If we would just spend that money, this whole issue would be solved. I mean, to a certain extent, right? If it's allocated and people take into consideration all that. So maybe the question is, how can we incentivize the private sector? And not us, we're not private sector, so we don't understand how they think. We want to throw the ball to them and tell them, how would you solve the problem? As private sector, how would you solve this global problem? Because in a way, it's going to affect them one way or another. So how could we get them into this conversation and find their, what attracts them, what incentivizes them to step up?
Right, and that leads into a question that I had, which is more broadly about the role of the private sector and the capabilities of it beyond the pharmaceutical industry. I can remember covering the aftermath of a cyclone in the Philippines a few years ago, and one of the biggest relief providers in that scenario was UPS, the freight company, because they knew how to get stuff from one place to another place, preserve it, and just get it out there. And I'm just wondering if anyone here has seen evidence of partnerships that bring in that kind of expertise and skill set, or are we just not there yet in a vaccine rollout, for example?
I can take that for what we're seeing in India, if that's useful.
Sure.
We are seeing private hospitals step in to set up camps in housing agencies. We are seeing, all of the cold chain infrastructure, a lot of it was built by the private sector stepping in, and the government really going to the private sector and asking the same question Dr. Dajani just asked the audience, that how would you solve this? Where can you step in, and how can we help you to do that?
Okay, we're going to get to the end of our time very, very shortly, and I want to close out with a question that might put us on an up note as opposed to a more miserable one, which we've been talking about. We're exchanging so much about the ills of the system that has led to the inequity, and I'm just wondering, from your own perspective, and feel free to personalize it. I mean, we know what keeps you up and worried, but what keeps you going because you're energized and you see a ray of hope, if you will. So who wants to go first? We'll do a round robin before we close in about 5 minutes. Okay, I'm going to pick you guys. Dr. Rana Dajani, what do you see here that represents something that energizes you because it offers some hope?
I think what energizes me is this feeling that we have to try regardless. We may not be able to succeed, and not to worry about what's going to happen, what are the results, because we cannot control that. But what I can control is what I do now. That's what I have control on. And it's about doing something. If it's just calling or writing or saying to do that little thing and not to belittle it, because it will go a long way. That's the butterfly effect. That's the chaos theory. When a butterfly flutters its wings, it moves the air a centimeter. There's a hurricane in time and space beyond that. That's what keeps me going. That every little deed counts.
Okay. Who wants to go next? Mahali, let's go to you, because you've had the frustrations that you describe, at the last mile, lacking resources. But what do you see that encourages you, Mahali, from where you are, whether it's in Lesotho or in West Africa, in the whole geography of the continent that Riders serves?
Yes, what encourages me is when you see people, when it's, yes, when you see people coming forward to access the services you provide, and for instance, when you go for an outreach where there's no clinic, when you arrive, the vehicle arrives with healthcare personnel, you see people waiting for this service. That is very encouraging. You realize that the people have built trust, some trust on the system, and they know that they are not forgotten. So you see people not defaulting on treatment, you see people getting their necessary vaccinations, then you know that you are doing your part to reach the people. We might not be there yet, but at least you know that you are contributing towards equitable access to these services. But also the question that comes in mind is, what if next year we have a bigger pandemic than COVID-19? What are we going to do? We have learned a lot of good lessons from this pandemic that we can start preparing for whatever comes next, any emergency that we come across, so that we can respond better and timely in future.
Okay. Fatima Hassan, you began our hour today talking about encouraging news. You know, is there more that you see on your dashboard that
yeah, I mean, I think,
better?
you know, so I think while governments have failed us on providing solidarity, they said they would at the beginning of this pandemic, what we saw was that frontline workers, including healthcare workers, community healthcare workers, volunteers, and a lot of activists around the world have actually mobilized to create the political change that we need. And for me, the window of opportunity is that this position that was taken by the Biden administration last night opens the window, finally, after many decades, to make the argument that medicines and healthcare should no longer be commodified, that it must be treated as a public good. And I think this pandemic has shown, you know, the world enough evidence and the reasons why that has to be a key demand of organizations going forward. So if we can decommodify healthcare and access to healthcare in the world, you know, that becomes a game changer.
Okay, about 30 seconds. Purnima, anything to add on something that you've witnessed in India or heard about that encourages you about what's happening there? None of which has been encouraging, I should add. But
I think just building on what Fatima said, the power of solidarity, and we see a lot of people coming together, organizations coming together and responding in ways that was just not possible earlier, collaborating in ways that was just not possible earlier. And hopefully this sets a precedent for the coming years to work together in a similar manner.
okay. Very good. I think we are pretty much out of time. I wanted to go through, I think everybody has access to the chat to everyone else, and I hope that exchange can linger for a while, but I think we're out of time to talk to one another face to face. I really want to thank everybody for participating and wish you all well in your future, and until our paths again cross, all the best.